Now, patients in public hospitals continue to be stranded as doctors maintain a hard stance that will accept nothing less than the implementing of the 2017 CBA and the speedy posting of intern doctors in tomorrow's meeting with the Ministry of Health leadership.
Well, the kmpdu leadership says it will attend the meeting but will not agree to mediation as suggested by the ministry. The doctors are also demanding that the meeting finds ways of committing to pay them salary increment and arrears for the last 7 years. Brenda Wanga reports.
From the parking lot to the waiting bay, the emptiness here tells of the picture of the impact of the ongoing doctor strike, at least here in Nyamira County. For the 4th day running, doctors have kept away from hospitals as they made good the threat to dump their tools, demanding that the government addresses their issues as contained in the collective bargaining agreement signed between the doctors and the government in 2017.
Currently, we are facing so many challenges because the doctors are on strike. We usually admit up to 30 patients per day, but now we don't have, we have only 3 mothers. We are planning to discharge the mothers because we don't have doctors on duty.
The Ministry of Health has, in the midst of the strike, extended an olive branch to the doctors in form of a meeting scheduled for tomorrow. The doctors say they will honor the meeting, but the agenda, at least on their part, will not be mediation.
The bare minimum, I would say, like something that we cannot discuss any further, is the posting letters for interns. These are things that has to be implemented. The basic salary arrears for the doctors as per the CBA 2017 and honoring the court order of 2021.
The union, we are not going for the meeting at the ministry for any mediation. Mediation ended in December last year. We had a 1-year mediation. By law, mediation should take 90 days. We gave them 12 months for mediation.
The doctors insist that they will accept nothing less than the immediate commencement of the posting of medical interns to health facilities. They say the interns should not only be posted, but be well compensated for their labor.
Those are things that we can't discuss. We want to see how they'll be paid. The issue of medical cover or comprehensive medical cover for health workers and for doctors, these are things that we cannot negotiate on.
The doctors went on strike on Thursday last week, demanding that the government posts medical interns, remits payment for doctors taking postgraduate studies, pay the doctor salary increment arrears dating back to 2017, and implement the 2017 CBA in full.
We have discussed with the ministry, with the Council of Governors, even in the year 2022 and the year 2023. So we expect to see a framework for them to implement them. When we are not on strike, we engage knowing that we can have framework of engagement or a framework on how this will be implemented and promises. But when we are on strike, we expect to be given solution to the issue. The result is what we expect.
The doctors have maintained that their industrial action will continue even as the talks kick off tomorrow, and have threatened to withdraw even the bare essential services that are currently being offered if the government does not heed and agree to their demands.
Asanteni sana, karibuni sana.
The tough stand comes as the chair of the Health Committee of the Council of Governors called on the national government to act speedily to resolve the standoff.
Na county governments ndizo huwa zinaandika madaktari, isipokuwa madaktari wa Kenyatta Hospital, Moi Teaching and Referral Hospital, daktari wa KU Referral Hospital ile level 5 na zingine. Lakini hizo zingine zote ni serikali za county. Lakini kazi ya training, kazi ya kufundisha madaktari na kuwafanyisha practice, hiyo kazi tuliwacha Ministry of Health kule Nairobi, na nyinyi ndio mlipiga kura ya 2010 mkasema iwache huko kwa sababu county inaweza kuwa ina uwezo wa kufundisha madaktari.
Brenda Wanga, Citizen TV.